Proper toothbrushing involves four things: a soft toothbrush, toothpaste with fluoride, a correct angle of brushing, and brushing in a pattern. It's important to brush at least twice a day using a soft toothbrush. A soft toothbrush also makes it much easier to remove the plaque below the gum line where periodontal disease starts. Use one of the toothpastes that contain fluoride. Fluoride hardens the outer enamel layer of the teeth. It might stop a cavity in its tracks and give you more resistance to future cavities. Angle the bristles of the brush along the gum line at a 45-degree angle and apply firm pressure so the bristles slide under the gum line. Vibrate the brush while you move it in short back and forth strokes and in small circular motions. Brush 2 or 3 teeth at a time, then move to the next teeth, allowing some overlap. Tilt the brush and use the tip to brush the backs of the front teeth. It's fine to brush in any regular pattern you choose, but since the insides of the teeth tend to get less attention, you might start with the insides of the upper teeth, then go to the insides of the lower teeth. Switch to the outsides of the upper teeth, then the outsides of the lower teeth. Brush the chewing surfaces of the upper teeth, then the lower teeth, and end by gently brushing your tongue and the roof of your mouth. This removes germs and keeps your breath fresh. Most cavities in periodontal disease begin between the teeth. While brushing is important, the bristles of your brush simply don't reach between the teeth. To keep your gums and teeth healthy, you must remove the plaque between your teeth at least once a day. That's why we recommend dental floss. Don't worry about the type of floss. They all work pretty much the same. Wind 18 inches of floss around the middle fingers of each hand, leaving about 5 inches between your hands. Pinch floss between your thumbs and index fingers and leave about 1 inch in between to work with. Gently guide the floss down between the teeth using a side-side motion. If your teeth are too tight to floss, or if it catches or tears, let us know about it. These are problems that need to be fixed. Pull the floss tightly in a C shape around the side of the tooth and slide it under the gum line. Clean the surface of the tooth by using an up and down motion, not side to side, until the surface is clean. When all the plaque has been removed, you'll hear the floss start to squeak. And pull the floss around the next tooth and repeat the process. Wind the floss to a fresh section and gradually work your way around your mouth, cleaning both sides of every tooth. If you have problems reaching some areas, you may want to use a floss fork. If your gums are affected, they'll bleed when you floss, and that's to be expected if you're just beginning to floss. After a week or so of regular flossing, the bleeding should go away. Now you know why brushing your teeth is only half the battle. Most cavities in periodontal disease start between the teeth. Your toothbrush simply doesn't reach. Sealants are a clear or white plastic that are placed in the grooves of the biting surfaces of back teeth. Back teeth have deep grooves and pits that are very difficult to keep clean. Plaque, which is a nearly invisible film of bacteria and food, collects in these grooves. Look how the plaque shows up after we've stained it red dye. Every time you eat, the bacteria in the plaque forms acid. Without sealants, these acid attacks can cause the enamel to break down and you get a cavity. To place sealants, you usually don't even have to be numb. First, you thoroughly clean and dry the teeth. A conditioning solution is applied. Then the sealant material is brushed into the grooves. Some types of sealants harden on their own, while others harden when it goes to a special light. Sealants are an important part of a preventive dental care program.